Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel that is related with the different types of the videos for the students, for the doctors, for the professors. Now I am making the serial that is Ayurveda in GP, that is Ayurveda in General Medical Practice. And today is the 12th video regarding in this serial that is diabetes mellitus, Madhumeha in Ayurveda. This is a typical disease which can be having problem with the sugar metabolism or the carbohydrate metabolism. Basically, pancreas is there, and pancreas, this organ is on the left side of your body, in the middle part of your abdomen, and it has specific types of cells which are called as the islets of Langerhans. And this particular group of cells, they produce the insulin, and this particular insulin hormone helps to enter that blood glucose into the cell. So insulin is taking sugar from the blood into the cell, and cell are always requiring energy for getting the glucose for performance of their cellular activity like energy production. Okay, so brain cell, liver cell, kidney cell, my hands and legs, skeletal muscle, every cell will depend its activity on the utilization of glucose. But before that, let me clear you that I am an educated and authentic doctor of Ayurveda, that is MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, my WhatsApp number given in the description, 9226810630. In Ayurveda, actually, prameha is described. Prameha is a different urinary problems. And in that 20 prameha vyadhis or the disease types, one of the type is madhumeha, which is related with the diabetes mellitus. Of course, we are going to discuss the classification and the causes, then investigations and the treatment. Primary diabetes mellitus, there is no definite cause for it. Now, there are two types: insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus. Basically, this insulin dependent diabetes mellitus is related with the childhood diabetes, that is juvenile diabetes. In that particular children, there is a atrophy or there is absence of islets of cells of Langerhans which is producing the insulin. So absolute absence of the insulin. So these people, these children has to take the insulin for their lifetime. So that is the insulin dependent diabetes mellitus. But in the afterwards, at the age of 30, 40, 50, when there is an imbalance, calorie intake and calorie output, if you are not doing proper exercises, sedentary lifestyle, eating all the time sugar, and your insulin is less, or insulin receptors, this is important concept, is more important. Sometimes insulin quantity is okay, but insulin on the cell, there are some receptors which welcome the insulin hormone. They allow the insulin hormone to act and enter the sugar inside. So when there is a lacking of insulin receptors also, there is a problem in the diabetes mellitus. By your regular exercise, walking and running, these receptors also can be increased. Try to understand this concept. Okay. Now, gestational diabetes mellitus, which is related with the pregnancy, first recognized during pregnancy, and automatically it goes away. 90% it goes away, but 10% in some ladies it continues even after the pregnancy. Okay, as a normal non-insulin dependent diabetes mellitus. Then impaired glucose tolerance. This is one of the condition where, for example, if normal fasting sugar is 80 to 120 milligram percent, and postprandial, that is post food, post lunch, that sugar is from 80 to 140 milligram percent. Okay, so what does it happen? That means after that level, this is called as a threshold level in your kidney, and after that level, kidney will start secreting or taking away the sugar and the urine, and you get the glycosuria. When you examine the urine, you will get the glucose present in that particular urine, and that can be tested by, the Benedict's solution is available in the, or there is auto analyzer also, and there are some strips also which you can just put, and color change you can see, and you can diagnose the glucose in the urine. Okay, so when the patient is having low threshold level, actually the patient is not diabetic, but his kidney, that particular threshold for the sugar is less. That means ideally above 120 milligram percent the sugar should come into the urine. But in some patient, even the blood sugar is at the level of 90, it comes in the urine. So that is not a real diabetes. Remember that. That is called as a impaired glucose tolerance. Potential abnormality of glucose tolerance. These are very rare conditions. Latent abnormality of glucose tolerance. Now, secondary diabetes mellitus associated with known conditions. Like for example, in some endocrine problems like acromegaly, Cushing syndrome, especially this is very important because lot of people, they are taking the tablet prednisolone, that is steroid tablet, and that is called as a magic tablet. It is very useful for bronchial asthma control, or the rheumatoid arthritis control, or psoriasis control, skin problems control. But the patient, by of their own, if they are engulfing prednisolone steroids for a longer duration, they will suffer from Cushing syndrome, and diabetes is a complication of or side effect of that steroid excessive taking. Congenital absence of islet cells that I have described, metabolic problems like iron overload, pancreatic calcification, drug induced. For example, as just now I have example, steroids. Steroid, the name of the tablet is tablet Visolon, very dangerous. Prednisolone, that is the same. Visolon is a market name, brand name, and prednisolone is a generic name. It is used mainly in the what you can say, the kidney problems, or other the rheumatoid arthritis, bronchial asthma. But don't take this tablet of your own unless and until doctor has prescribed it. Next, investigations. Common is the fasting and postprandial blood sugar. Remember, after you finish the lunch, you have to reach to the laboratory within 1.30 to 1.45 minutes. Not before that and not after that. If you reach late, that result will be wrong. So postprandial sugar should be done. Actually, I will personally recommend that fasting and postprandial is for the known diabetic. But if you are doing first time, I will recommend fasting and post glucose blood sugar. That means after you go in the morning, empty stomach, and then the doctor or the pathologist or the assistants, they make a sharbat of glucose. 75 gram sugar is dissolved in the water, little bit lemon essence is added, and that particular sharbat you have to drink. And after taking that sharbat, you have to come after 1.5 hours to the laboratory to take post glucose blood sugar. So postprandial is for known diabetic, post glucose is for not known diabetic. I think this is very clear. Then complete GTT, glucose tolerance test. First fasting sample is taken, then you have to give that glucose sharbat, and then every half an hour, 0, 30 minutes, 1 hour, 1.5 hour, and 2 hours. These 5 readings are taken. That is called as a complete glucose tolerance test. Graph is plotted and final result is out. Then modified GTT. What is there? Fasting, then immediately after 1 hour and immediately after 2 hours. So there is no half an hour duration, but every hour, that is called as a modified GTT. Okay. Then glycosylated hemoglobin, that is HbA1c, is a very good to get average blood sugar, because there are some what you can say, the mischievous type of the patients. When they know that now today tomorrow I have to go to the laboratory and test my sugar, immediately before they take a very less food, absolute fasting, near about fasting, and then they are cheating to the doctor. Oh, see, my result is okay. Otherwise, they are making the apathya or the kupathya and eating a lot of sweets. So to avoid this particular, what you can say, the lacunae in the result, the doctor always advised to do the glycosylated hemoglobin. Okay, and random blood sugar is also there. Whenever, anytime, any of the daytime, you go, and if your blood sugar is more than 200 mg/% at any time of the day with urine sugar, then definitely you are prone, or you are already having a diabetes. Next treatment for the diabetes mellitus. Diabetes insipidus is different. Remember those terms. Diabetes mellitus is deficiency of insulin, and diabetes insipidus is a deficiency of pituitary hormone, that is ADH, antidiuretic hormone. When it is less, the patient is having a lot of urine. Now, the most important, before starting the treatment, let me clear you when you can suspect the diabetes. There are 3 P. Remember, write down 3 P. P means for polyphagia. The patient is too much hungry, because the cells require carbohydrate. Cells require the glucose for the energy production, but that sugar is not entering into the cell. It is in the blood, but it is not in the cell. That is the problem. So the patient is always eats a lot. It is a pseudo false hunger that is called as a polyphagia. Then he has a lot of urine day and night, especially when the patient gets up at night for nearly 4-5 times, then it is called as a nocturia. Nocturia, night urine, nocturia. That is polyuria. So polyphagia, polyuria, and lot of water is going with the urine. So patient is always thirsty, always thirsty. That is polydipsia. So 3 P's you should not forget. Remember 3 P's: polyphagia, excessive hunger; polyuria, excessive urine; and polydipsia, excessive thirst. Okay. In addition to these symptoms, some patients may have the weakness, tiredness. Middle-aged patient, if he complains of the weakness, always do the hemoglobin or the hemogram and also the blood sugar. And third is, of course, thyroid. Okay. So these are the important things. Then there may be repeated ulcers on the penis. Not ulcers, actually, inflammation. That is called as a balanitis. Balanitis repeatedly is also indicating the patient may be suffering from diabetes. Non-healing wound. Non-healing wound. If there is a wound and it is not properly healing, you suspect diabetes mellitus. So there are some indications where you can suspect that diabetes mellitus, and early diagnosis makes the good prognosis and good management. But diabetes mellitus is not treated only with the medicines. Very clear. Always Ayurveda says any disease, tripod is important. Tripod, and tripod is basically important in the heart problem, in the diabetes, in the obesity. Ahara, vihara, and aushadhi. Ahara, food control. Pathya and apathya, food control. Ahara, vihara, lifestyle management. Always, for example, diabetes, regular walking, regular exercise is must. Avoid the totally sweet food stuff. That is very clear. And then aushadhi. So 3 things, if you do together, then only there will be results. Only one way, there is no result at all. So now about the medicines, prescriptions. Chandra Prabha tablet, 2 tablets 3 times in a day. Jasada Bhasma, 100 milligram plus Suvarnamakshik Bhasma when there is anemia and weakness. 125 milligram 3 times in a day. Jamva Sav, 3 teaspoons with equal amount of water after meals. And for energy purpose, a lot of weakness in the dhatu or the tissues. Vasanta Kusumakara Rasa, 1 tablet every day with betel leaf and the milk. Next, tablet DBN, Indian Pharmaceutical Company, 2 tablets 3 times in a day. You can add in this particular above preparation. Next, prescription, my dear friends. Madhumehavati Hari Parashuram Aushadhalaya from Pune, Maharashtra State, India. It is of Khadiwale Vaidya. He has prepared some fantastic medicines. Madhumehavati. I have used all these medicines. That's why I am recommending to you. 2 tablets 3 times in a day. Arogyavardhini, liver is the biggest factory in the, so carbohydrate metabolism, to make it regularize, a liver should be properly functioning. Arogyavardhini is always acting on liver. 2 tablets 3 times in a day. Then Madhumeha Kadha of Hari Parshuram Aushadhalaya Pharmacy from Khadiwale Vaidya in Pune, Maharashtra State. 4 teaspoons with equal amount of water. Rasayana Churna again from Hari Parashuram Aushadhalaya, Khadiwale Vaidya, Pune, Maharashtra State, 1 teaspoon 2 times in a day. My dear friend, next prescription for diabetes mellitus, Madhumeha. Jasada Bhasma is a Kleda Nashak. Kleda is an excessive liquid waste product during the tissue metabolism. So Jasada Bhasma, Trivanga Bhasma, Chandra Prabha, Shilajit, these are the best medicines for diabetes. Jasada Bhasma plus Vanga Bhasma 120, Shuddha Shilajit 50 milligram, Suvarnamakshika Bhasma for anemic condition 50 milligram, then Shrunga Bhasma if there is a cardiac element also 50 milligram, Pravada Bhasma 50 milligram 3 times in a day. Next prescription, Bangashil from Allersin Company, 2 tablets 3 times in a day, Fortage tablet from Allersin, 2 tablets 3 times in a day, Asanad. This is the Ayurveda Rasashala Pune Pharmacy. Ayurveda Rasashala Pune, best tablet Asanad, 2 tablets 3 times in a day. Next prescription for diabetes, Teliya Asanad Bharad, that is Ayurveda Seva Sangha Nashik. Soak 8 teaspoons overnight. This is particular powder for decoction. Filter and drink it in the morning. Then Shuddha Shilajita Ayurveda Seva Sangha Nashik, 500 milligram to 1000 milligram per day. Then Shilajita Vati, Allersin Company, 2 to 4 tablets 3 times in a day. Then JK22, Charak Company. JK22 is the name, 2 tablets 3 times in a day. Next prescription for diabetes mellitus, Haridra plus Amalaki Churna, mentioned by even Vagbhat, 2 teaspoons at bedtime with warm water. Then Talkeshwara Rasa, that is a Baidyanath tablet, 1 tablet 2 times in a day. Then Vasanta Tilaka Rasa, that is Suvarna Muktik Yukta, Vasanta Tilaka Rasa, 1 tablet 2 times in a day. Next is a next prescription, Madhumehar Yoga from Baidyanath, 2 tablets 3 times in a day. Then Madhu Tard from Jhandu Company, 1 sachet in a glass of water before meals. Then what is that? Trivangashila Jhandu Company, 2 to 4 tablets 2 times in a day before meals. DBT. Personally, I have made the research on DBT tablet from Sharanjar Company. Best tablets for diabetes, 2 tablets 2 times in a day. Now, let me tell you about my DBT. It contains the Gudamara Churna, Jambul Bija Churna, and Haridra, etc., and Shilajatu also. DBT tablet, I personally in the Pune research with the modern, what you can say, the Institute of the Diabetic Association in Pune, and we have found that DBT given in the more dose, 3 tablets 4 times in a day, definitely reduce the blood sugar level. But please do always the blood sugar level checking, because to begin with, you have to do the adjuvant treatment, allopathy and Ayurveda together, and slowly you have to reduce the dose of allopathy medicines. Next regimen, check for the food, exercise, and medicine daily. Always avoid unnecessary intake of water. Always use the fried flour of wheat, rice, barley, black gram, etc. Before use, you have to fry it so that it is become light for the digestion. Make sure that the patient takes plenty of bitter gourd and leafy vegetables in the food. Try to take the astringent, pungent, and bitter medicine every day, such as the Haritaki or the Haridra, Jambula Bija, Methi Bija. Control always the weight. Weight is the important hurdle in treating the diabetes. Avoid the sleep as soon as the meals, and especially during the daytime. Every day, at least 1 hour exert, that means regular walking and running should be there. So my dear friends, this is all about the very important disease in our general medical practice, which should be treated with diet, exercise, and medicines. Okay, diabetes mellitus. I hope your insulin dose will be definitely reduced by Ayurvedic regimen and Pathya Pathya. So I request all of you, we have to see whole the series of this Ayurveda and GP. So please don't forget to subscribe to my YouTube channel and share this video, like this video, and make your good comments to make enthusiasm in Professor Deshpande. Thank you very much. Take care. See you in the next video. Take care.